So CRPS sometimes called as a complex regional pain syndrome or chronic regional pain syndrome. Both way it can be called, and it is a chronic neuropathic pain. It is not an acute pain, it is a chronic neuropathic pain disorder with a significant autonomic features that is also associated with that, and typically develops in the extremity after acute tissue trauma and persists beyond the duration of normal QE. That is the entire definition of CRPS. For number one, it is a chronic neuropathic pain. Second, it is associated with autonomic features. Third, it develops usually in the extremity after a trauma. And four, it persists beyond the duration of normal healing. All these 4 points we have to give for its definition. And in addition to the classic neuropathic pain characteristics like intense burning, hyperalgesia, allodynia, etc., there may be local edema and changes suggestive of autonomic imbalance or involvement like altered sweating behavior, skin temperature changes, and trophic changes in the skin, hair, nails, etc. can be present with loss of strength. And it's also divided into two. The other name for CRPS1 is reflex sympathetic dystrophy, and the other name for CRPS2 is tarsalgia, reflecting the presence or absence of documented nerve injury. The signs and symptoms are related to all these things. This picture gives you an idea about what are all the things that are seen. Mostly it is in the extremity. So the injury or trauma is shown in the hand here or the wrist, and then the whole thing affects the whole thing. The three colors are given for peripheral and central mechanisms of the happening of CRPS, and the pink one says the typical signs and symptoms of CRPS, and the blue thing shows the mechanisms based on the treatment, how the treatment is based on the mechanism. So the changes that happen, the pathophysiology is there is a neurogenic inflammation, trauma, inflammatory response, then there is a peripheral sensitization of the nerve, sympatho-afferent coupling, then central sensitization, maladaptive neuroplasticity. So starting from the periphery, the changes gradually go up to the brain. So all these changes have, and this also results in psychological symptoms and increase in catecholamines. Then the typical signs are there is a sympathetically maintained pain, then focal osteopenia, then inflammatory signs like edema, redness, heat, pain, dysfunction, then spontaneous pain or hyperalgesia, allodynia, central motor symptoms such as severe dystonia, disturbed body scheme. All these things are the signs and symptoms. And the mechanism of based on the treatment are physiotherapy, occupational therapy, intrathecal baclofen, analgesics, combination of analgesics, short-term treatment of steroids, bisphosphonate, sympathetic blocks, behavioral cognitive therapy. So this one picture gives you all the information that is needed for that. Anyway, the etiology, it can be fracture, surgery, genetically mediated. Evaluation you can do by Budapest criteria, which is a pain disproportionate to the inciting event. Report of one symptoms, 3 out of 4 following categories like sensory, which reports as hyperalgesia or allodynia, vasomotor, temperature alteration or skin changes, pseudomotor reports of edema and skin changes, motor and trophic changes which are there seen in the skin, nails, etc. The third thing is display of at least one of the signs. So patient may complain, that is this symptom that the patient gives, the signs that you elicit also related to the above categories. And finally, there is no other diagnosis. So it becomes a diagnosis of exclusion also. Okay. So that is how the whole thing. The summary of pathophysiology is a mechanism. Altered cutaneous innervation leads to central and peripheral sensitization, leads to altered SNS function, increase in circulating alteration in the catecholamine level, lower norepinephrine versus unaffected limb, Then inflammatory factors, brain plasticity, genetic factors, and psychological factors. So all these things are the mechanisms of, and this is a picture again to show how all these mechanisms are working to produce this chronic pain condition. So that is our treatment. Pharmacotherapy, anti-inflammatory medications, including oral corticosteroids and non-inflammatory, have been tried. Bisphosphonates, which inhibit the bone marrow cell proliferation and migration of inflammation, and routinely used in bone-related problems. It is more useful after a fracture repair or fracture surgery. And anticonvulsant and antidepressants like gabapentin and amitriptyline, NMDA antagonists like ketamine, interventional therapy can do sympathetic blocks, lumbar sympathetic block for the lower extremity and stellate for upper extremity. Then spinal cord stimulations also have been tried. Dorsal root ganglion stimulation also they have tried, and so that completes the answer for that. So this much is enough for the CRPS question. Okay. Will you go to the next one?
Yes,
Last
sir.
question.
Yes, sir. I will be presenting, sir. My topic, good evening, sir. My topic is tumescent anesthesia, local anesthesia in patient posted for liposuction and abdominoplasty. Tumescent anesthesia means definition: tumescent anesthesia technique of liposuction is a modification of wet technique. A large volume of low concentration of lignocaine and very diluted epinephrine is infiltrated into a targeted fat compartment prior to liposuction, producing a swelling and firmness. Tumescent means swelling and firm. It is discovered by Jeffrey Klein, US Dermatology. Pre-op instructions: thorough history should be elicited. Any bleeding disorders, any infectious disorder, poor wound healing, and emboli, thrombophlebitis. Liposuction in contraindicated in patient with severe cardiovascular disease during pregnancy and severe coagulation disorders. Routine investigations like complete blood count, BT-CT, PT, and blood sugar, LFT, liver function test, viral markers, ECG. We have to check before that. Advice to stop smoking and oral NSAIDs. Injection vitamin K to decrease post-op bruising. On the day of surgery, lorazepam 1 mg per oral or oral clonidine 0.1 mg should be administered to decrease anxiolytic and to prevent epinephrine-induced tachycardia. Solution preparation. The solution name is Klein solution. It contains lignocaine, epinephrine, bicarbonate, and 0.9% NaCl. Lignocaine dose is 35 to 55 mg per kg body weight. That is 1 mg per ml. That concentration is 0.05 to 0.1%. Epinephrine is 1 in 10 lakh solution dilution. That is 50 mics per kg maximum. Bicarbonate is 10 to 12 milliequivalents of 8.4% bicarbonate is added. Then intra-op monitoring. Baseline vitals should monitored and recorded pre-op and monitored intra-op. A peripheral IV line is maintained during surgery. Keep the patient engaged by hearing music during entire procedure. Different areas like abdomen, thigh, buttock are not generally combined in one session. If patient decides more than one area or more than 4 to 5 liters of fat removal procedure may be repeated anytime after 2 weeks. Procedure, it contains 2 steps. Induction of anesthesia by tumescent anesthesia is first step. Making 4 to 8 small incisions called adits, 1 to 3 mm in size, and needle is inserted, connected to the anesthetic solution and advanced through subcutaneous fat along same path intended for liposuction cannulae. Introduction of a large amount, 1 to 4 liter of Klein solution into the fat which contains lignocaine. It will provide local anesthesia. Normal saline balloons fat tissues. Epinephrine causes vasoconstriction. Bicarbonate, it increases pGUS because local anesthetic is acidic and decrease the injection pain, enhance of the infiltration of onset. Tumescent, wait for about 30 minutes after tumescent for the infiltration fluid to percolate properly and its full pharmacologic effects to take effects. Second step is aspiration of fat by microcannula liposuction. Sucking the fat of thorough microcannulae, which are 1.5 to 3 mm in diameter, leaving the incise tools open to drain out fluid, and small amount of fluid is left back in the tissues and allowed the drain slowly over a days. Residual fluid provides analgesia in the immediate post-op. Applying compression bandages and sending the patient home without any hospital admission. Advantages: minimal blood loss, advantage of safety, lack of need for hospital admission, lesser local anesthesia toxicity. Since subcutaneous fat has low volume of blood flow, lignocaine is lipophilic, so easily sequestered in fat. Diluted epinephrine causes vasoconstriction and decreased systemic absorption and bleeding. Very low dilution of lignocaine in clean solution. In post-op, we should continue antibiotics, analgesics. Same amount of fluid in left weekend in 3 to 5 days, and that addicts will give post-op analgesia. Addicts are not sutured and allowed to heal by secondary intention. Tight pressure bandages are essential in 2 layers for 2 days. Complications: sinus bradycardia and fluid overload. It may lead to pulmonary edema in cardiovascular patients. Minimal post-op pain, post-op edema, and post-op syncope. That's all, sir. Thank you.
Is there any antiseptic effect in that? Does Tumescent prevent infection? It's supposed to have that effect also. Okay.
Local anesthetics have some.
What is the duration of post-op analgesia after Tumescent? How long does the analgesia last?
Up to 2 days.
1 to 2 days.
Up to 2 days. Normally 8 to 12 hours. Okay, 8 to 12 hours is the duration of analgesia.
Okay, sir.
Do they have? Is there any other alternative composition?
Instead of normal saline, we'll use oral lignal.
Oral as a base. Okay.
Yes, sir.
What is the name of that? Who modified that?
Hertz's for.
It's called Hunt's solution. HUNT. Hunt. Okay.
Yes, sir.
And
Yes,
some
sir.
people add dexamethasone also as an
Okay,
anti-inflammatory for anti-inflammatory effects so that post-op, because they keep on introducing the cannula repeatedly and keep sucking the fat, that may produce inflammatory edema. So one of the complications you have to describe here is also what's called seroma. So the using will continue for several days. It's called seroma.
Yes, sir.
So I'll just show you the presentation on that.